Hello, my fellow Guyanese, and welcome to this program at DPI. Today, we'll be looking again at another in a series of educational talks and presentations regarding the COVID-19 pandemic, what you need to know and how to make ourselves better prepared, and how to understand some of the actions taken and some of the steps that we need to take in order to beat this pandemic. So I have three questions that I'd like to address today. What you should do if you think you are exposed. And that's a big question these days because as the number of cases increase, more people want to know. They're finding out that they've become exposed to someone who may test positive, who may have symptoms suggestive of being positive. And so it's becoming a big cause of concern and anxiety in the country. So what do you do? If you think you've been exposed, and if you can get tested, of course you will get tested. But right now we have a challenge in getting the test results back on time. So in the meantime, you will isolate yourself to the best of your ability, avoid sick relatives, elderly relatives, children, and essentially as many people as you can. If you need to be alone at home or in a facility, you need to make the right calls with your employers, your colleagues, your friends. Let them know where you are. It is also very important and something responsible for you to do to inform others who you may have been in contact with. And what do you do to help yourself? Some things that you can do. Make sure you load up on vitamin C. If you don't have vitamin C tablets, then lots of local fruits have vitamin C. Oranges, lemons, limes, cherries. All of these things have lots of vitamin C. So you have to be able to increase your intake of vitamin C and foods rich in vitamin C. The next thing to do is to load up on zinc. If you can't have zinc tablets, which I believe comes as 50 milligram tablets, if you can't find those, then lots of foods have zinc in them. Meats, fish, legumes, all of these things have high zinc content. So make sure your food content is right, your support consumption is correct, and you give yourself a better chance. Now, if you start to develop symptoms, and these symptoms are fever, cough, shortness of breath, body aches, loss of taste, loss of smell, these are all important things for you to take note of, and if these happen, then you seek immediate medical attention, because these are the early stages and can lead to real catastrophe if not taken in hand. Okay? So that is what you can do if you think you are exposed. Now, the next big thing that is trending is these rapid tests or antibody tests that are available. And I will try to draw some of this so that we could all understand how this process works. So if you bear with me, let's put it on a graph. Let's start with a simple graph that we all know in school. Day 0, day 7, day 14, day 21, and day 28. Now when you get an infection, right away, the viral particle is present in your body and it starts to rise. It peaks around 14 and then drops and basically disappears by 28 days. That's the majority of patients that will happen in. So if you have any test, or the PCR test or the antigen test, which is a test for the viral protein, during this period, it will show positive. But your body doesn't start to respond right away. You start to now create your own defense mechanism by day number 7. And the early defense mechanism is called IgM, or immunoglobulin M. So that starts to rise from day 7, peaks at 14, and essentially disappears by 21. That is your acute and immediate response. Your long-term response your body also starts to produce soldiers to fight in the long term. And that starts about between week 2 and 3. It goes up, and if you're lucky, it can continue for a long time. So we are finding out that it can last for as long as 4 months, 6 months, and it can persist and prevent you from getting infection again. So if you understand these graphs, this is your virus, this is your IgM, and this is your IgG. Now, how do we use this information? For the first 7 days, you have no symptoms. Symptoms basically start after the 7 days and get peak about 14 days, and then it starts to disappear. So in this first 7 days, most people don't know they have any infection. So, and if you test here with the rapid antibody test, you will not find anything positive, and you will go away with a sense of false security that you are negative and nothing is wrong. But you would have already had viral particles that can infect your friends, your family, etc. And which is why it's so very difficult to control this. The usefulness of these rapid kits or antibody tests is between just after the first week to the second week. This is where the IgMs become positive. And some kits actually include IgM and IgG. And so if you have a positive in IgM, you're in the early stages of the infection. And if you have a positive in the IgG alone, you're in the late stages of the infection. So I hope that clarifies the use of these rapid kits. It is not useful in the early part of the infection, and later on, it can have very useful purposes in determining infection rates in population and more epidemiological science. So those are my comments as it relates to the rapid kits. The other question I want to address, rather, is this whole concept of lockdown. And these should more appropriately be termed strategic lockdowns or conditional lockdowns, because no country has really been able to eliminate sustainably this virus by locking down. Locking down completely for a long time is not sustainable. You shouldn't have to choose between fever or starvation. And countries that completely lock down, they're either economically devastated, or as soon as they open up back, they then have surges in infection. So lockdowns, they're like a valve, a tool to be used to basically reduce the rate of infection, to ease the burden on the healthcare system. So right now, if we believe that too many people are becoming infected, too many critical patients are occupying all of the ICU beds, etc., that is the time to activate a strategic lockdown. And once you have control over the rates of infection, the rates of very sick patients coming to hospital, that is the time when you could ease off a little bit on your lockdown, make it a little bit more liberal, because people still have to work, still have to earn, still have to get food for their families. And you can use this lockdown as a tool throughout the course of this infection and this pandemic to be able to gain more control over your resources versus your need in this pandemic. We looked at 3 specific questions. What to do if you think you were exposed to somebody who is positive. We addressed those concerns. We looked at the usefulness and the utility of antibody testing or the rapid kits that are available. And then we looked at the strategic lockdowns as a tool to control severity of the infection and the rapid spread of infection that utilize your healthcare resources. So thank you very much for listening.